In the high-stakes world of advanced cardiovascular life support, or ACLS, seconds matter. The difference between life and death often hinges on a rapid and coordinated response. At the very core of this response lies airway management. Without a clear passage for air to enter and exit the lungs, all other resuscitation efforts are, well, futile. Imagine a fire raging inside a house. Before extinguishing the flames, firefighters must first secure a clear path for air to enter. This allows them to breathe and effectively combat the blaze. Similarly, in ACLS, establishing a patent airway is paramount. It's the first and most critical step in the chain of survival. A compromised airway can result from a variety of causes, such as a foreign object, trauma, or even a swollen tongue obstructing the passage. When airflow is restricted, oxygen delivery to vital organs, including the brain, is significantly reduced. This can lead to brain damage in a matter of minutes, and ultimately, death. Therefore, mastering the art of airway management is non-negotiable for any healthcare professional involved in emergency care. From basic maneuvers to advanced techniques, a thorough understanding of airway management principles is crucial for ensuring the best possible outcomes for patients facing life-threatening emergencies. When someone collapses and stops breathing, the first few moments are critical. Often, the simplest actions can mean the difference between life and death. Before reaching for complex equipment, healthcare providers must be adept at basic airway maneuvers. These techniques, though seemingly simple, can quickly open a blocked airway and restore the flow of oxygen. The head tilt chin lift is often the first maneuver attempted. Gently tilting the head back and lifting the chin opens up the airway by moving the tongue away from the back of the throat. This technique is particularly helpful in unconscious patients where a neck injury is not suspected. The jaw thrust, as its name suggests, involves manually moving the jaw forward. This maneuver is preferred when a spinal injury is suspected, as it minimizes neck movement. By displacing the jaw, the tongue is pulled away from the airway, allowing for air to pass through. These basic maneuvers are not only essential for healthcare professionals, but can also be life-saving when performed by trained bystanders. In those crucial minutes before medical help arrives, knowing how to open an airway can be the difference between tragedy and a second chance at life. Once an airway is open, the next step is to ensure adequate ventilation. This involves getting air into and out of the lungs. While mouth-to-mouth resuscitation can be effective, it carries risks of disease transmission and can be uncomfortable for both the rescuer and the victim. This is where pocket masks and bag valve masks come into play. A pocket mask is a small portable device that acts as a barrier between the rescuer's mouth and the patient's face. It has a one-way valve that directs the rescuer's breath into the patient's lungs while preventing the backflow of air and secretions. Pocket masks are easy to use, inexpensive, and widely available. Bag valve masks, commonly known as BVMs, are handheld devices that provide positive pressure ventilation. They consist of a self-inflating bag, a one-way valve, and a face mask. When the bag is squeezed, air is delivered through the mask and into the patient's lungs. BVMs are more effective than pocket masks, especially in patients with weak or absent breathing. Both pocket masks and BVMs are essential tools in ACLS. They allow rescuers to deliver breaths safely and effectively, ensuring adequate oxygenation until more advanced airway management techniques can be implemented. In some situations, basic airway maneuvers and ventilation techniques may not be sufficient to maintain a patent airway. This can occur due to anatomical factors, severe swelling, or the presence of foreign objects. In such cases, nasopharyngeal and oropharyngeal airways provide a valuable bridge to more definitive airway management. Nasopharyngeal airways, or NPAs, are soft, flexible tubes inserted into the nostril and advanced until the tip reaches the back of the throat. They are designed to bypass any obstruction in the nasal passages or oral cavity, allowing for easier ventilation. NPAs are generally well tolerated, even in conscious patients. Oropharyngeal airways, or OPAs, are rigid curved devices inserted into the mouth and positioned over the tongue. They prevent the tongue from falling back and obstructing the airway. OPAs are typically used in unconscious patients, as they can trigger gagging or vomiting in those who are awake. The selection of the appropriate airway adjunct depends on the patient's level of consciousness, the presence of any facial trauma, and the rescuer's experience. Both NPAs and OPAs are valuable tools in the ACLS arsenal, providing a temporary solution to airway compromise while preparing for more advanced interventions.